Welcome to another episode of our Hypertension Unmasked and Wellness podcast series brought to you by the South African Hypertension Society. I'm your host, Echbert Boezak, and today's episode will feature insightful questions and answers to deepen understanding of the relationship between hypertension and kidneys. And joining us now is Dr. Meagan Dudley. She's a specialist physician in nephrology from Mediclinic Constantiaberg and a board member of the South African Hypertension Society to tell us how to protect your kidneys and what signs to watch out for and how managing your blood pressure might just save your life. Dr. Dudley, I got your title right, that is correct?
Yes, correct. I'm a specialist physician and nephrologist at Constantiaberg Mediclinic.
Let's start, and I've had a lot of discussions here on a number of podcasts with people about hypertension and the silent killer that it is. But doctor, you focus on kidneys. Tell us how high blood pressure affects your kidneys.
Yeah, thanks, Echbert. That's a great starting point. I must say it's a pleasure to be speaking about this very important topic today, and to be raising awareness on this. So, high blood pressure or hypertension puts strain on the blood vessels throughout the body, including the tiny vessels in the kidney. And eventually, the glomeruli, which also contain tiny blood vessels called capillaries, and which are also the important filters that remove waste and excess fluid from the body, become damaged by high blood pressure. And over time, this constant pressure causes scar in the kidney, which reduces the kidney function. And unfortunately, this damage is often irreversible.
Doctor, as a layman, I'm going to ask you this question. What causes these damages to your kidneys? Is it lifestyle? Is it what we eat? Is it what we drink? What causes this?
There are a number of causes. The most common cause for chronic kidney disease is hypertension. Patients who are diabetic are also at risk. Those who are over 60 years old are also at risk. Those who are of African ancestry also at risk of chronic kidney disease. And lifestyle does play an important part. So a diet that's high in salt, lifestyle where there's lack of exercise, and even smoking is a risk factor for chronic kidney disease.
Doctor, now most people will ask, well, goodness, can it be reversed? Can kidney disease sort of cause high blood pressure in that case?
Yes, absolutely. So both acute and chronic diseases of the kidney can cause high blood pressure, with hypertension being much more common in the latter, so in those patients with chronic kidney disease. And when the kidneys are damaged from whatever other cause, they can't regulate fluid or salt levels appropriately, and there's an increased activity of certain hormones that control blood pressure. And it then becomes a vicious cycle. So as blood pressure increases, further kidney damage occurs, which in turn worsens hypertension.
Doctor, that sounds like a bit of a dangerous cycle there, doctor. What are the early signs people can look out for if they might be experiencing kidney damage and high blood pressure?
Okay, so good question, but unfortunately early on there may be no symptoms, which is why both hypertension and chronic kidney disease are called silent conditions. But warning signs can occur, and often they tend to occur when the kidney disease becomes more advanced. And those signs include swelling in the ankles or the feet, shortness of breath, fatigue, poor appetite, even nausea and vomiting, and a generalized itchy skin, which we call pruritus. So you can imagine that if these conditions are silent, the best way to catch it early is actually just through routine tests, because often patients are not ill when they experience these conditions. And these routine tests are blood pressure checks and a urine test for protein, both of which can be done at a day hospital or a GP or even certain pharmacies. And the GP or day hospital can then recommend a blood test to measure your kidney function. So the important thing is screening for high blood pressure and kidney disease with blood pressure checks, urine checks, and maybe even a blood test.
What you're saying to me now, concerns me slightly. I mean, if it's in your family, is it hereditary, or Are there any specific groups of people who are higher at risk for the cycle of hypertension and kidney disease?
Yeah, so this sort of ties into I think the second question you ask. So who develops, this sort of disease? Patients with diabetes are at risk of developing chronic kidney disease with hypertension. Those with a family history of kidney disease, individuals over 60, and certain populations, like I mentioned, those of African ancestry are more prone to hypertension and chronic kidney disease, people living with HIV, and also women who've had a history of preeclampsia during pregnancy are also at risk of hypertension and chronic kidney disease after the pregnancy, and actually that risk is continued throughout their life. And like I also said, lifestyle does play a factor. And one of the biggest role players is a high salt diet, as well as a lack of exercise or a sedentary lifestyle. And importantly, smoking. It does put you at risk of chronic kidney disease. It doesn't necessarily increase your risk of hypertension, but it certainly increases your risk of chronic kidney disease.
Yes, doctor, I was thinking of everything that you were saying right now, and I'm a massive coffee drinker. Probably like 3-4 cups before 12 o'clock. I don't have to worry with drinking my coffee, right?
So, yeah, I mean, caffeine is not associated with chronic hypertension, but I would be much more worried if you were telling me that you were taking, hot chips every day with some vinegar and tomato sauce. It's mostly the high salt intake and that kind of, lifestyle and eating food that is associated with high salt obviously also leads to obesity. And that's, that's another strong risk factor for hypertension and chronic kidney disease. So caffeine, can transiently increase your blood pressure, but it's usually not one of those sustained causes of chronic hypertension. There's often other things that are contributing to the development of hypertension.
So, doctor, while I'm now going to run to the kettle to go put on, to go heat the water for another cup of coffee, you spoke about lifestyle. What can people do to protect their kidneys then if it's discovered that they do have high blood pressure?
Okay, so what can you do at home? I would first thing is pay attention to diet. And again, the important factor here is the salt intake. So that's what you have to limit to prevent hypertension and also to even manage it when you have hypertension. And you've got to limit it to less than 2 grams per day, or in other words, less than 1 teaspoon per day, which is quite difficult to imagine, I think, because you're not really measuring salt in that way from a day-to-day basis. So I would say avoid adding salt to food and also avoid the hidden salts. So that means avoiding the processed foods, the takeaways, anything that's sort of pre-packaged is going to have significant amount of hidden salt. And the more you are cooking fresh or from scratch at home, the better. The next one is physical activity. So, we'd encourage physical activity most days of the week and at least 30 minutes. And obviously that also contributes to maintaining a healthy weight. Number 3 is avoiding anti-inflammatory medications. These can harm the kidneys. In addition, patients with hypertension, anti-inflammatories can actually make hypertension more difficult to manage if you are using it quite regularly. And then going for regular checkups to monitor your blood pressure and kidney function. And that is even more important in those patients who I mentioned were at higher risk. So the patients with diabetes, the older individuals, you've got a family history of kidney disease, or women who had preeclampsia during pregnancy. So again, and that's part of the screening. And again, just to reiterate, it's important just for that checkup because often you don't have symptoms until quite late. And then lastly, if you have hypertension, just to take medication every day as prescribed by your doctor to control blood pressure, ideally below the value of 130/80. And if you have any questions about your blood pressure tablet, or you have inkling or feeling that you're on too much, or you don't want to be on this, or you're not happy with it, rather to reach out to your health professional and discuss those issues before you change the medication yourself.
Doctor, that's quite disturbing, but in the same way, very, very practical advice. I mean, nothing obviously beats a healthy lifestyle, eating healthy, going to gym, which I will start shortly. But for our listeners who are listening now, can kidney damage essentially be reversed?
So kidney damage from high blood pressure, there are certain circumstances where reversibility is possible, but where it's reversible, it's often not reversible to normal. It might get better slightly once the blood pressure gets controlled, but it's very unlikely to ever go back to normal. And those would be very extenuating circumstances. In most cases, chronic hypertension, where the blood pressure has been uncontrolled for years, causes chronic kidney disease that's not reversible. Yeah, and I think that's the reason why these sort of talks are so important, so people are actually aware. I want to also just say, so let me just add, it's not reversible. And in some instances, however, we could slow it down. But in most instances, it's not, reversed. And again, this is why early detection of blood pressure and consistent management is so important in the prevention of chronic kidney disease.
Doctor, just one more question from me. What is the one message that you want listeners to remember from our conversation today?
If I had to sum it up, know your numbers. Know your blood pressure number, know your kidney function number. Know your numbers. Don't wait for symptoms, because by the time they appear, the damage might already be done. So get your blood pressure checked, get your kidney function checked. Be empowered. Take control of your health.
As you say, empowered, but also that was some powerful words, Dr. Dudley. That's it, I think. Thank you so much for joining us, Doctor, and sharing your expertise on hypertension and looking after your kidneys.
Thank you. Thanks so much. It was a great pleasure to be here. Thank you, Echbert. Great questions.
Thank you, Doctor. And to our listeners, as you heard, take care of your kidneys, take your blood pressure, and stay informed. Also, our sponsors, thank you to Novartis, Pharma Dynamics, Sandoz, Servier, Zydus, and Omron for their unconditional support. And as the doctor says, measure your blood pressure accurately, control it, and live longer. You can also visit your local pharmacy, your clinic, or your medical practitioner. And to learn more about expert insights on hypertension, top tips for healthy blood pressure, follow the South African Hypertension Society on social media or visit www.hypertension.org.za. I'm Echbert. Boezak. Thank you, Doctor, and thank you for listening.